My name's Hannah. I'm going to be your nurse today. You're here for a physical?
Yes.
Okay. Let me get my thermometer. Okay, can you stand up for me? I'm going to wash my hands first. Okay. I noticed on the patient when she walked in, her gait was smooth and steady. She's well nourished and weight is appropriate. Let's see here. Her height in the hallway was 65.5 inches and her weight was 148 pounds. Can you tell me your name?
Johnny's Trammell,
And your date of birth?
6/26/57,
Where are we today?
Pocahontas, Arkansas.
Okay. Can you tell me what year it is?
2016.
Okay, patient is alert oriented ×3. Okay. Patient is well groomed. Weight is appropriate, well nourished. Okay. Okay, can you, your arms out please? Like that. Okay, let's see, it looks like arm span to 65.5 like her length, okay? Just stay standing, push your arms to your side, there you go. Out 30.5. And 37.5. Okay. All right, you can have a seat. Okay, get your blood pressure. Okay. (130/86). Let's get the other arm to compare. Okay, just go. Okay, now raise your arm up, please. There you go. Okay. 130/88. Comparable. Okay. And check your pulse, please. Okay, 72 and graded 2 plus. Okay, 72 as well and graded 2 plus. Rhythm is normal. I'm going to feel both at the same time. They're in sync. Everything feels good there. Also notice respirations were 18. Okay. Are you in any pain at all?
No.
Okay. Sure. 97.4. 97.4. Okay. I'm going to feel the head. Please tell me if you have any tenderness at all. Okay. Okay, no lesions, no masses, more cephalic feel. I can feel the cranial bones. Nothing feels abnormal, no deformities. Okay, I noticed earlier the face is symmetrical. Also noticed earlier the patient walked in, her gait was smooth and steady. I can see that her, she's able to gaze around the room, she's relaxed, the facial expressions are relaxed. Let's see here. Alright, I'm going to check your temporal artery. Okay, it feels smooth, other side. Smooth. Okay, open your jaw for me. Any pain or tenderness?
Mm-mm.
Okay. Alright, so let's see. Facial skin is olive. There's no edema, no involuntary movements or tics. Let's see, okay. The neck is able to hold the head erect. And let's see. Okay, now if you could follow what I do, just turn your head this way. And then your chin down to your shoulder. Okay. Now the other side, same thing. Chin down to the shoulder. Okay, now touch your chin to your chest. Okay, and then chin up towards the ceiling. Okay, range of motion's good on the neck. Okay. I feel her thyroid. Okay, can you swallow? Okay, it's hard to swallow again for me. Okay. Thyroid's really hard to palpate, which is normal. Okay, trachea is midline. I said there was no edema on the face. Accessory muscles are normal and even. Okay, I'm going to feel, let's see, your lymph nodes. See if any are palpable. Let me know if anything's tender. Check your cervical nodes as well. And the other side. Okay, that feels fine. Okay, so we did head, face, and neck. Okay. No lesions noted on the face as well, or deformities, and skin looks fine. Let's see here. Okay, that was head, face, and neck. Let's do the hair, skin, and nails. So I'm gonna look at the hair. Hair color is brown. It's evenly distributed. Let's see. No signs of inhabitants or pests. No lesions. Let's see. It's just distributed evenly. Hair is evenly fine all over. Okay. The skin has a good olive complexion. I don't notice any lesions. I'm gonna check your tartar here. Tartar's good. Check it on the hand. Tartar's good on the arm. Tartar's good there. Let's check here. Okay. No edemas not on any of the skin. No lesions. No bruising. No. Let's see. There's some freckles. No, but no other depigmentation. No moles noted. Okay. Skin looks good. Skin is also warm. Hair, skin, and nails. Okay, let's check your nails. Okay. Nails look good. They're evenly distributed. They're smooth. No brittleness. They're round. Let's see. They're clean. I'm gonna check the capillary refills. Less than 2 seconds. Okay. Okay, and color is pink as well on the nail beds. Okay, that was hair, skin, and nails. I'm going to go to eyes and ears. Okay, eyes are normally in sockets, no protrusion or sunkenness. Also on this, we'll be doing a couple of tests, which I'll do in just a little bit. Let's see here. See, the sclera looks good. White and clear. I'm going to check your conjunctiva. I'm just going to be stitching near the bottom of your eyelid. Okay, pink. A light pink. Okay, eyelashes look good. No lesions. They meet well with the eyelids. No drooping of the eyelids. These look good. Okay, eyebrows move symmetrically up. Can you raise your eyebrows? There we go. They both symmetrically move up. Okay, that's good. Okay, let's see here. Cornea is good. It's looks moist, glossy. Irises are both the same color. Pupils are equal size, about 3 millimeters. Okay, let's get this real quick. Okay. Let's see if the pupils react to light. Okay. Can you look at me? Okay, they constrict. Both of them constrict. Okay, so they react to light. Okay. Now if you could just look at this. Now look at the wall. Okay, look at this. Look at the wall. Sorry. Okay, pupils constrict so they accommodate. So pupils are equally round, they react to light, and they accommodate. Okay, before we move on to the ears, we would do the Snellen chart, which is we have a chart in the hallway where you will stand 20 feet away, and you'll look at the 20/20 line and tell me what it reads. Can we go ahead and go do that now? You just unplug it? Okay. Let's go this way and do glasses. Glasses? And you can put this on so you won't be cold.
I think they're in my purse. Thank you.
Right down here. Alright, just stand right here. It's about 20 feet away.
Do you want my glasses on?
Yes, put your glasses on. Stand right here for me. And look this way. I'm sorry. Okay. Cover your left eye. Okay, can you read this line for me right here?
It kind of.
Okay, let's read this one. That'll be better.
F B D 3 2 2 3.
Okay. Let's do the other eye. Can you read that now?
Yes.
Okay.
FELOPZD
Okay, I have this one. Can you read that one?
DEFPOTBC.
Okay, so your left eye is 20/20. Let's go back to your right eye. Read this one for me.
POFCZF.
Okay, this one.
PDGFD. No, wait.
It's okay.
FECFD.
You're gonna need to see the eye doctor for your eye.
Okay.
Okay, so let's do both eyes. Can you read this out with both eyes?
Yes, DEFPOTBC.
Okay, let's go back to the room. You're gonna need to get that. Was it right in your right eye?
Mm-hmm.
Let me get that checked out. Okay. So that's one of the 5 tests we do on the eyes. Now we'll do the confrontation test. Okay, so I'm gonna do, just leave your glasses on. Is I'm gonna make bunny ears around your head, and when you can see my fingers, tell me, okay?
Okay.
So, look straight at me. There you go.
That's it.
Okay.
See,
Okay.
Sam,
Okay.
Sam,
Okay.
Sam.
Okay. Good job. So that was the confrontation test. Now we're going to do the cover test. Let's see here. Okay, look at me. I'm going to cover one eye, but keep your eye straight, okay? Okay? Another one? Okay, no sudden movements, eyes stay straight, okay. We're going to do the cardinal position, so just look at my finger and follow my finger, okay? We're here, 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 here. This one's tricky. Here, good job. Okay, now this way, this way, this way, and this way. Perfect. Okay, cardinal positions with the cover. Okay, let's do the corneal light reflex. Okay, we got this light again. Can you take your glasses off for me?
Sure.
Okay, just look straight at me, okay? I'm just going to shine this light. That looks good. Okay, corneal light reflex isn't the same. It's about, it's at the same spot in both eyes. It's to the, right, both are at the right side. Okay, that looks good. Okay, so we've tested all your eyes. Let's go to your ears. Okay. Just gonna pull your hair behind your ears. Okay, ears are symmetrical. Do you feel any tenderness when I do this?
No.
Okay. I don't know any lesions. Your ears are warm like the rest of your body. No lesions or tenderness on this side. Okay. Let's see here. I don't notice any wax on the outside or any discharge or foreign bodies on either side. No lesions. Let's see here. I notice a little bit of wax. That looks good. Okay, no foreign bodies. Excuse me. Okay, no foreign bodies. No discharge, just a little bit of wax in there, which is normal. Okay. All right. Okay, can you cover that ear for me? I'm going to whisper in your ear and you tell me what I say, okay?
99.
Okay. Other ear.
Baseball.
Okay. That's good. Okay. Usually we would do the Weber and Ryan test with the tuning fork, but I don't have that today. So let's just demonstrate with this. With the Weber test, we'll say this is the base and this is the fork side. I would hit it and vibrate. I would put it on her head and she would tell me when she could quit hear, or if she could hear tone both equally in both ears. Okay, and then for the Ryan test, air conduction should be longer than bone conduction, so I would strike it, quickly put the base on her mastoid process right back here, and then whenever she told me she couldn't feel the vibration anymore, I'd put the fork in front of her ear and count the seconds on that as well. The air conduction, which would be this, should be longer than this. Okay. Okay. You don't have any tenderness or anything back here, do you?
No.
Okay. 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 Alright, so ears look good. Okay, so eyes and ears, now we're going to do, let's see here, nose, mouth, and throat. Okay, nose is proportionate with the rest of the face. It's symmetrical with the rest of the features. Okay, let's see. No deviated septum. Can you put one finger over your nostril? Okay, breathe in. Okay, other side now. Okay, patency is good. Okay. Okay. Let's see. I don't notice any sores or lesions on the outside of the nose. Skin color is good. Okay. This part might tickle, but we're going to look inside of your nose.
Okay.
Okay. So I'm going to look at the median and inferior turbinates. I'm going to be looking for any polyps or discharge, color, and if it's moist. Okay, so I'm just going to stick it right here. You okay? I'm sorry. Let's lay back. There we go. You comfortable?
Uh-huh.
Okay. No polyps. No discharge. Nose is normal color, slightly pink. Okay, let's look at the other side. Okay. Sorry. Okay. No discharge, no polyps. I'm looking at the median and inferior turbinates, no lesions, it's moist. Okay, no drainage. That looks good. Okay. Alright. Any tenderness on your nose at all?
No.
Touching inside at all?
No.
Okay. Okay, let's look at your lips. Corners of mouth is even. Lips look a little dry, but nothing to be worried about. No cracks or lesions or fissures or anything like that. Okay, let me grab my light again. Actually, let's look at, can you stick out your tongue for me? Okay, sit straight up for me. There you go. Okay, now let me look. Okay. Dorsal side has papilla on it, which would be her taste buds. Okay, do this. Ventral side is smooth and with veins. Okay, that looks good. Okay, let me see your teeth. Okay, teeth are wide. They're white. They're evenly spaced. No debris. Okay, I'm gonna look at your gums. Teeth meet good with the gums. The gums are light pink. No bleeding, no inflammation or anything like that. Okay, gums aren't sore or anything like that.
No.
Okay, let's look at the buccal mucosa. Okay. Sorry, I'm gonna put this over your head. Okay. Open your mouth wide for me. Okay. Buccal mucosa is good. It's pink. It's moist. No lesions. Looks like on either side. Teeth look good back there too. No debris or anything like that. Okay. All right. Look at your tongue. Tongue was good. Good color. Moist. Mouth is moist. Okay. Just take a breather for a minute. Okay. Now let me look again and just stick your tongue out for me, okay? Okay. Hard palate looks like a light pink, almost white. Irregular transverse rugae. Hard palate is white right here. Soft palate is pink. Okay, take a breather. Okay, and soft palate is moist, have no lesions. Okay, stick your tongue out and say ah. Okay, let me get a tongue blade. Okay. Ready? Say ah. Okay, uvula is midline. Okay, and take a breather for a minute. Uvula is midline, and the soft palate and the uvula rises when she says ah. And that tests the vagus nerve. Okay. Okay, let's look one more time. Have you ever had a tonsillectomy?
Mm-mm.
Stick your tongue out for me. Stick your tongue out. There you go. Okay, now say ah. There you go. Okay, tonsils are graded 1+. They're pink and no exudates. And the pharyngeal wall, is pink and moist. Okay? All right. Okay. So that was the nose, mouth, and throat. Okay, I'm going to check your sinuses. You let me know if there's inner tenderness, okay? Okay, this is her frontal. Feel any tenderness at all there?
No.
Okay. Maxillary. Any tenderness there? Okay, good. Also, we would normally check for transillumination on that. Okay, can you lay back for me? So on the maxillary sinuses, okay, open your mouth for me. Okay, if you were to put the light right here, you would see a red glow inside the mouth, which I don't see one. side. Okay. Okay. Alright, so transillumination on the frontal. Okay. I'm just going to put it right here between your eyes, okay? Sorry. I see a red glow around the top there. Okay. Check the other side. And a red glow there as well. Okay. Also on the eyes, which I forgot to mention, I'm going to check her lacrimal gland, so if you can just sit up straight for me. Okay, I'm just going to push right here, okay? Tell me if you feel pressure. Feel? Okay, everything feels good there. Okay. Okay, so that was eyes, ears, nose, mouth, and throat, and sinuses. I can't remember if I did your neck, so I'm going to go ahead and do that again. Did I examine your neck?
I don't think so.
Okay.
No.
So on the neck holds the head erect up. The patient is able to move normally from side to side. Let's do the range of motion. Okay, I need you to just follow my direction. Just turn your head this way and touch your chin to your shoulder. Same thing on the other side. Okay, now chin to neck. To chest, and then chin up to ceiling. Okay, good deal. Okay. Now push your face, turn your face against my hand. Okay. Okay, other side. Nothing swollen or anything like that. Okay. Okay, let's see here. Okay. Thyroid. Just gonna feel. Can you swallow? Okay, the thyroid's hard to palpate, which is a good thing. No enlargement noted. Also, I can't remember on this if I did your face. Okay, so let's just. Did I examine your face? And let's just do it again, just to be safe. Okay. On your face, it looks like it all is symmetrical. Your eyes are symmetrical, your ears are symmetrical, the corners of the mouth are symmetrical. Skin is an olive color like the rest of the body. Okay. And okay, let's see here. No facial tics or edema noted, or no involuntary facial movements. So we did your head already and your hair. Okay, and let's do we do your nails? Okay. Let's see here. Okay, let's do your chest and your lungs. So if you could take that first shirt off for me. Thank you. Did we do the nails on this video? Okay, let's just look at your nails again to be sure. Okay, nails are round, clean, smooth, no brittleness, cap refill less than 2. Yeah, we did do this. Okay. Okay. That looks good. Just wanted to be sure. Okay. So, with your lungs, okay, I'm going to look. Okay. Can you stand up for me? I'm just going to look at the shape of your lungs and make sure, yeah. Looks like the lungs slope down about a 45-degree angle from the spine. Okay, that looks good. Okay, no barrel chesting noted. Okay, so your lungs look like No masses, I don't see any masses or anything like that. Okay, you can have a seat for me. Okay, respirations are even and unlabored as well. Also, facial, the face is relaxed, the posture is good, no tripod positioning. I noticed earlier on the assessment, the skin and the nails and the lips are pink, they're not blue, so no signs of distress. And I already asked the patient about her orientation, so she's alert and oriented ×3. Okay, now I'm going to inspect. So, okay, stand up for me right here and face that wall. Okay, so just scoot back a little bit. There you go. Okay. So actually, let's make sure this can see. Okay. Okay. Take a deep breath for me. Okay, equal chest expansion on that. Okay, you can have a seat. Actually, yeah, go ahead and have a seat. I'm going to move this table down. Face, while you're seated, you can face this way, that wall for me. There you go. Okay. Every time I move my hands, I'll need you to say 99, okay?
Okay.
Okay, so start now. Say 99 for me.
99, 99, 99, 99.
Okay. That feels the same on both sides, so that would be the tactile firmitus. Firmitus sounds, feels the same. Okay, now you can face me again. Okay, on the chest and the lung area, I don't notice any masses or lesions. Let me feel back here. No masses or lesions. Well, masses noted. I'll check for lesions when I do her stomach. Okay, now, okay, trachea, let me put your trachea. Okay. Trachea is midline. Okay. Now I'm going to percuss. So let's, let me give you this pillow. Lay back for me. Okay. Let's see here. I'm going to go ahead and put your, actually sit up for me. I'm going to have you lay on your stomach. Let me fix this table so it'll be comfortable. This is going to rise, so. Okay, now you can turn over on your stomach for me. And I'm going to raise your shirt up, okay? Are you comfortable?
Yes.
Okay. Okay. So now I'm just going to be doing percussion. Okay. Let me get my reflex hammer. You should hear resonance over all lung fields on the back. Over the scapula, you will hear flatness though. Okay, that sounds good. Okay, let's see, I'll go ahead and have you flip back over. And you can sit up, and I'll put this foot down. Okay. So that was the percussion part. Now we're going to listen to all lung fields with each breath. Okay, so let's just go ahead and start out the back. Okay, every time with my stethoscope, I'm going to have you take a deep breath, so I'll try to go slow, okay? So I should be hearing vesicular sounds in all lung fields. So, deep breath. Deep breath. Okay. Just can you turn to that side for me? I just want to make sure they can see this. Okay. So I'm on my 6 point right here. Breathe in. 7, 8, 9, 10, 11, 12, 13, that's 14. So 15 is going to be kind of over more. 15, 16, 17, 18. Okay, now we're going to do the sides. Okay. Breath sounds sound good. No adventitious sounds. Okay, now can you face me while you're sitting down? I'll do the front side. Okay. Okay. One more time. One more. Okay, vesicular sounds all there as well. Along the sternum, I hear a little bit of bronchovesicular sounds. Okay. Now, if I was to hear any abnormal sounds, which I didn't hear any adventitious sounds, and there's no abnormal breath sounds as well, but if I was to hear any adventitious sounds, I would check for bronchophony. So what I would do is every time the stethoscope touches your back, say 99, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Okay. If it was louder and clearer than normal, it might suggest consolidation. Okay. Now for the whispered pectoriloquy, you're going to whisper 1, 2, 3, and the same thing. If I hear it louder or clearer than normal, then it might suggest consolidation as well. So whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, that sounds fine. And for the last part, egophony, you're going to say E, and if it sounds like a nasally A, then that might suggest consolidation as well.
E, 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 E.
Okay, that sounds normal. Let's go ahead and listen to the lower parts too.
E, 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 E.
Okay, it sounded like a normal E, didn't sound nasally, like a nasally A. Okay, so that's that part. That would be your lungs. Okay, now this is just something we teach to do at home, which is do you do your monthly breast exams?
Yes.
Okay, to check for early detections of cancer. So, on a normal patient, go ahead and lay back. We won't be actually doing it, I'm just going to show you what I would do. Can you lift this arm up? Before I do this, I would first inspect while the patient was sitting up. I would look and make sure that each breast was even, normal coloration, no deep indentation, no dimpling, no masses, no just upon inspection. And then I would look at the nipples and areola, look for any discharge or any masses, or look and see if I can see any abnormalities on that. Make sure they're both the same color. Then I would have the patient raise her arms and look at the axilla, but I do see that there's there's no lesions or lymph nodes. And then also, let's see. Okay, so then I would, also while I was inspecting, I would have the patient, while her shirt was off and her breasts were exposed, I would have her lift both her arms up and up all the way here, make sure each breast moves symmetrically up. Now for the breast exam, I would have the patient lift one arm up. I would go, I would feel in the axilla, sorry this tickles, and go in a circular motion, and I would go from the top circular motion, I would go laterally, go down all the way. I would go slower than this, and just feel for any masses or anything abnormal. I would also feel under the breast, and I would do the same on the other side and have the patient lift that arm up. Okay, you can sit up. Okay, so I'm going to teach you how to do a self-breast exam at home. You're first going to inspect, so you would look in the mirror, you would look at both breasts and see if you notice any dimpling or masses or anything abnormal from each month to month. You're going to check between the 7th and 14th day of your menstrual cycle each month, but if you don't have a menstrual cycle, check on the same day each month. Okay, so you can pick like the first of each month. So you would inspect, you would look, raise both your arms, make sure they move evenly, look for any masses or anything like that. You're going to turn to the side, you're going to look on the side, same thing, look for any differences, any abnormalities or masses, then turn to the other side and look. And then while you're in the shower, you can just do your breast exam. You can, like I said, go in circular motions, even feel up in your arm right here for any even lymph nodes or masses or anything tender or anything like that. Also make sure when you're doing this to lift your arm up while you're doing it and check even under your breast and do both sides. And then also do it while you're laying down at home and put one hand behind your head and check that way as well for any masses, and then do the other side. Okay, so let's see. Let's go ahead and do your abdomen. Actually, let's go ahead and move to your heart. Okay, so I'm going to have you lay back for me. Okay, can you look that way? Looks like the jugular vein is fully collapsed here. Okay, can you look this way? Jugular vein fully collapsed here as well. Okay. Everything feels fine there. Okay, can you sit up for me? Okay, now we'll be feeling for the carotid artery. Feels smooth. Upstroke is faster than downstroke and grades 2+, which is normal. Okay, other side. Same thing. Now I'm going to listen for any bruise. So when I tell you to hold your breath, just hold your breath so I can listen, okay? Hold your breath. No bruise there. Same on this side. Hold your breath when possible. No bruise there. Did I hear the pulsation? Okay. Now I'm going to look at the chest, which is the precordium. Skin is normal. I already checked the Turgor, but Turgor is good. Okay, skin is pink, moist, no lesions. A little bit of freckles, other than that, no other depigmentations. Looks like no heaves or lifts visible from the heart. I'm going to feel for any thrills. None notable. Everything looks fine there. No masses or lesions noted. Okay, so I'm going to feel for your apical impulse, which is going to be right under your breast, okay? So, sorry. Okay, 1 to 2 centimeters, okay. That feels fine. Okay, now I'm going to listen to your heart. So I'm just going to make this comfortable for you. I'm just going to lift this back up and have you look at that. Good?
Yes,
Okay. All right. There's 5 places I'm going to listen to. The aortic, which is going to be the second intercostal space. Tricuspid. Herbs is third. I'm sorry, this was the pulmonic. And that's the second intercostal space on the left side. Herbs is third intercostal space on the left side. Everything sounds good, no murmurs noted. This is the tricuspid, the fourth intercostal space. Sounds good. And the mitral is going to be right under your breast, okay? So just bear with me. Okay, no murmurs, that sounds good. I'm going to listen to your apical pulse. Also, your S1B is going to be loudest at your apex. So I'm just going to look right up under your shirt. Let's just do it this way. Sorry. Usually you listen for the apical pulse for a full minute, but I did for 15, you times it by 4, and it was about 72. Okay, I did notice, sorry, the S1 is loudest right here at the apex. S2 is going to be loudest at your base. Okay. Now, no murmurs were heard or any abnormal sounds. Okay. Okay, just sit up straight for me. Okay. So, arms kind of like this. Okay, arms are even length, and I noticed that earlier when I was doing her arm span. Let's see here. No lesions noted. Any tenderness at all? Okay, skin is warm, it's olive color, no depigmentation. Little freckles noted, but no moles, no tenderness, right?
no.
Okay, so I'm going to look for any epitrochlear or lymph nodes. None noted there. None noted there. Any tenderness?
No.
Okay. Okay, let me see your fingers. I'm going to check the cap refill again. Okay. Less than 2. Nail beds are pink. Everything looks good there. Okay. Let's see. I'm going to check your radial pulse again and make sure, which I did earlier, both beating at the same time. Looks good. Now your brachial. Okay, that's really good. Now we're going to do something that's called the Allen's test. can you put your hand up here for me? Okay. Flip that like this. There you go. So this is where I hold the ulnar and the radial side. And you clench your fist real tight. Open your hand. Okay. All right, can you bring the camera up here, please? Okay. Clench your fist for me. Okay. And let go. The hand is blanched. I'm going to let go of the ulnar side. And the hand is now flushed with at a pretty good time frame. So the Allen's test is good. Okay. Other hand. Clench your fist real tight. Okay. Release. Hand is blanched. Let go of the ulnar side. Hand flushes back. Okay. Okay, now we're going to check the legs. Okay, just uncross your legs for me. Alright, legs look good. No lesions or warm here. Okay. Notice a little bruising right here. No masses. Any tenderness?
No.
At all? Okay. Alright, okay. Let's see here. Measure your calf. Both sides. .34.5 centimeters and 34.5 centimeters. Okay, that looks good. Okay. Now I'm going to ask you to dorsiflex your foot, which is where you pull your foot up. Okay? Any pain anywhere?
No.
No pain in the calf?
No.
Okay. Negative Holman sign then. Okay. There's 4 places to check for a pulse. It's going to be femoral, which is going to be right in your groin, behind the knee. Okay, that's felt 2 plus. 2 plus there as well. Okay, I'm going to take your shoes off. Also, earlier when I was checking the upper extremities, I did notice that all the pulses were graded 2 plus and everything felt fine. Okay, so this is going to be your dorsalis pedis. 2 plus feels good. 2 plus here as well, that feels good. Okay, so posterior tibial. 2 plus there. Two plus there. Okay. Okay. Let me think. Okay. Let's see here. Okay. So far no masses or lesions. No, one bruise on the leg. Okay. Let's move on to your GI. So I'll have to have you expose your stomach. Okay. Yeah, you'll have to, okay. Okay. Alright, so. Okay, stomach looks evenly round. Okay, skin is warm. Okay, no inflammation or enlarged organs noted just by looking. Umbilicus is midline. No hair on the stomach. There's some respiratory movement in the stomach, which is normal. Skin is normal color of the rest of the body. Okay, now I'm going to listen. I listen in all 4 quads. You can come in, it's fine. Just come in. I just need those clippers. It's okay. I wonder what they're saying. I would get them for you, but I didn't know where they were. That's
I
fine.
don't know where the heads are.
That's fine. You
Sorry.
can look around if you need to.
No, that's where they would be. I mean,
Okay.
they should have been sitting. on the
Okay, yeah,
fence.
you're fine. You can come back. Okay. All right, so I'm going to listen. Normal active there. Normal active there. Normal active there. And normal active there. Okay, so now I'm going to percuss, so just leave like that. I'm going to lay you back a little further, okay?
Okay.
Whoops, sorry. Let's get this up front again. Okay. Okay. So now I'm going to percuss. Okay. I should hear timpani in all places. Let me turn those off. Okay, that sounds good. Now I'm going to look for the liver, measure the liver span. So I'm going to start here and go up. Mark a little spot right here. Okay. Okay, can you move your hands for me? I'm just come up a little bit, okay? Sorry. Here. It's noted to be about 9.5 centimeters. Okay, can you turn on this side for me? I'm just gonna feel for your spleen. Here, let me, sorry, let me raise your foot up. Sorry, I know it tickles. So I'm just feeling for the spleen. I don't feel any spleen enlargement. Okay, lay back on your back for me. Okay. You hear timpani here now. I'm going to ask you to take a long, slow, deep breath in, okay? If it changes to flatness, it's going to suggest spleen enlargement, okay? Deep breath. Okay, let it go. Okay, one more time. Okay. Okay, sound didn't change. Okay, so that looks good there. Okay, now I'm gonna palpate. Just light palpation, not deep, for any enlargements at all. Any tenderness? Okay. No masses or organ enlargement noted. No rigidity. Also, when I was listening to her bowel sounds, I didn't hear any vascular sounds. Okay, everything feels good there. Okay, please sit up for me. So, after we did your GI, okay. We did arms, legs, your breast exam, chest, lungs, GI. We did your extremities. Let's go ahead and we did your heart. Okay. We're going to do your nervous system now. Okay. So, I'm going to check your cranial nerves first, which we've already done some of them. So let's see. Okay, cranial nerve 1 is going to be olfactory. That's going to be your smell. So I'm going to test your sense of smell. I've got 2 different things right here, so just close your eyes for me. Smell this. Tell me what it smells like.
Raspberry?
Yes, that's right. Okay. Smell?
Coffee.
Okay. All right. Olfactory nerve is intact. Let's. Number 2 is the optic. We already did that with the Snelling chart out there. That was intact. Okay. Now we're going to do 3, 4, and 6. 3 is 3. Let's see, your oculomotor, your trochlear, and your abducens. So we already checked those with your all the we did. Your pupils are equal, reactive to light, and they accommodate. So they react to light, they accommodate. We did the cardinal positions. Your eyes move inward, and in all other positions. Okay, and let's see here. So we did all your eye movements. So then the 5th one is your trigeminal. Okay, just pretend like you're chewing. Okay, that looks good. Smooth movements. Any pain at all?
None.
Okay, so I'm going to have you close your eyes, and I'm going to touch you, and you tell me if it's, and then after I touch you, you point where, okay? Okay. Now, okay, feel the difference between this. That feels kind of sharp, huh?
Mm-hmm.
Okay, and that feels like light, okay?
Mm-hmm.
So once I touch you, I want you to tell me if it's light or if it's sharp, okay?
Sharp.
Okay.
Sharp. Light. Light.
Okay, good job. Okay, now I'm going to test your cornea sensation. We're still on the trigeminal. Okay, so I'm just going to touch your eye barely. Okay. Okay, good. The other side. So I just got a little wisp on it. Okay, good. Okay. So we did the first 6. We're going to move on to 7, which is your facial. Okay, clench your teeth. Blow out your cheeks. Smile. Raise your eyebrows. Stick out. Well, no, that's a different one. Okay. All right. Facial is intact. So that's 7. 8 is your acoustic, which we already did with the voice test and the Weber 9, which I didn't have my tuning fork. And then we're going to do 9 and 10, which is the glossopharyngeal and vagus. So we already tested your soft palate, your uvula and your soft palate rise when you said ah. And then, let's see here, let me think about this. We did your soft palate, and we're going to do, you're able to swallow normally. I noticed you swallowed fine when I spelled your thyroid. That's good. This one's kind of the bad part, but we're going to test your gag reflex, okay? So it's kind of like what they do when they do a strep screen. I'm going to stick out your tongue and say, and you don't have to say anything, but might gag, okay? So that's what we're looking for. Okay, sorry. Okay, so that was your gag reflex. Okay, so that was 9 and 10, your glossopharyngeal and your vagus. Now we're going to go to your spinal accessory, which we already did. Shrug your shoulders against my hands. Good. Turn your face against me. Okay. Again. Good. Okay. Now we're going to go to the hypoglossal, which is the 12th from the last. Stick out your tongue. Okay. Midline looks good. Okay. Okay. Let's see here. The hypoglossal will test for the articulation of words, and I've noticed the patient speaks fine, articulates words well. Okay, now on to a passive and active range of motion. I'm going to note for any muscle rigidity or any pain or involuntary movements. Okay, so we already tested the neck. That was fine. Okay, put your hands against mine. Okay, push down. Good. Push up. Good. Now do it on your own. Up. Okay. All right. Good. That looks good. No involuntary movements. Okay. Let's see here. I'll put your arm out to your side. Okay. Push up again. Down. Do it on your own. Up and down. Okay. No involuntary movements. Okay. Up. Sorry. Down. Okay. Up and down. Okay. There we go. Push your feet against mine. My hands. Good. Up. Up. Any tenderness on moving any of these muscles? Okay.
No.
Now up and down again. Okay, your ankles. There you go. Okay, knees up and down. There you go. Hips, okay. Alright, looks good. Okay, let's see here. Now we're going to go to your cerebellar function. Okay, I noticed earlier the gait was smooth and steady. Now we're going to do the Romberg test. Okay, so what I'm going to do is have you stand up for me and get your balance, okay? Now you're going to close your eyes for 20 seconds. Okay, put your feet together. Look at me. Just go and look at me and put your feet together. Okay? All right. Now. Okay. 20 seconds, close your eyes. Okay, right now, close your eyes. There you go. We're going to hold this for about 20 seconds. It's going to seem like a little while. There's minimal swaying with the patient, which is normal. Okay, open. Good job. Okay, now you can sit down. So that was 2 things on cerebellar function. Okay, now we're going to do the rapid hand movements, okay? So you're going to put your hands right here and flip back and forth as fast as you can. Okay, looks good. Now do this and then put them against like this. Okay, so do that. Okay, looks good. Okay, now touch each finger to your thumb. Try again. You don't have to do it fast, just do it. Okay. There you go, other hand. Okay. I want you to touch my finger and then touch your nose. Now we gotta do it with your eyes closed. Okay? Close your eyes. Touch my finger. It's right out in front of you. Okay? Touch your nose. Right here. Right here. Touch your nose. Okay, good job. Okay, so that was 4. We did, okay. Alright, we did your gait was smooth and steady. We did your Romberg, rapid hands, fingers, so that was 5. Okay, so now I want you to move your shin, move your heel down your shin. You can do it right up here. Good, other side. Perfect, okay. Now we're going to test your spinothalamic tract or spinothalamic column. It's going to test for temperature. We'll do temperature, pain, and light touch. Okay? So I'm going to touch you in several spots, and you're going to tell me where. Left arm, left leg, right leg, chest. Okay? You ready? Okay. So put your arms down.
Left.
Oh, close your eyes. Sorry.
I have to tell you what.
Yes, and you have to close your eyes. Okay.
Left arm. Left wrist. Right arm. Left leg. Left shin.
Okay.
Right knee. Right hand.
Okay, good job. Okay. We would also test for let's see. We would also test for temperature, And that's all, let's do temperature. Let's see. This pen is pretty cold. Feel it?
Cold.
Yeah. Okay. So, I have you close your eyes. Let's see if I got something warm here. Let's see. Okay, this one feels pretty warm. Okay. So you feel how that's kind of warmer and this is cold?
Mhm.
Okay. So I'm going to touch you in various places and you tell me whether it's warm or cold, okay?
Cold. Warm. Warm. Cold. Warm.
Okay. Alright, open your eyes. Okay. Like I said, also we would test for pain, but do you have pain sensations all over your body? Do you ever have any pain at all?
No.
I mean, do you feel pain?
Oh, yes.
Okay. So then we're going to check your posterior column tract. We're going to test for vibration, but what we do, we'd have a tuning fork. I would strike the tuning fork and place it on your finger pad, and you would tell me whenever the vibration stops, but I don't have a tuning fork, but that's how we would do that. Also, we're going to test for position. Maybe close your eyes and point one finger up. So close your eyes, one finger up, and I'm going to move your finger and you tell me whether it's left or right, and it could be your left or right, all right?
Left. Right. Down. Up.
Okay, good job. Okay, so now we're going to do 2-point discrimination. I'm going to have you close your, well, here's what it's going to feel like. I'm going to take this paper clip. Okay. So obviously you feel, you can watch this, you feel 1 there. Here's 2. Okay, so you're going to tell me if I do 1 or 2, alright? And you're going to close your eyes. Okay? Sorry.
2. 2. 1. 1. 2.
Okay, good. Let's do the other hand.
1. 2.
Okay, good job. Alright, so now we're going to test for stereogenesis. I'm going to put an object in your hand while your eyes are closed. You're going to tell me what it is, okay? So close your eyes. Open up a hand for me. Close your hand. What is that?
A key.
Okay, good. So keep your eyes closed.
A coin.
Okay, good job. Okay, now we're going to test for anesthesia. Close your eyes. Open up your hand. I'm going to draw a number on your hand facing you, and you're going to tell me what it is, okay?
Two.
Okay, good job. Okay,
4.
good. Okay, let's do the other hand.
4. 9.
Okay, that was a 9. Okay.
3.
Okay, good job. Alright, so now we're going to test your reflexes. Okay? So first, we're going to do upper extremity reflexes. Okay, just relax your hands. Okay, there you go. Let's go ahead and do the biceps reflex first. I'm just going to depress that biflex tendon right here. Can you see this? Okay. Alright, so I'm just going to... You'll see that biflex muscle contract. Okay, did you feel that?
Yes.
Okay. Alright, so we're going to do it on both sides. Biceps. Feel that tendon right there. Feel that?
Yes.
Okay. Now we're going to do the triceps. Alright. Feel that?
Yes.
Okay, did you see that? Okay, we're going to do this side too. Let's do it like this. So put your arm like this and kind of relax it. Okay, good. those reflexes, they're graded 2+, which is normal, all those that we've done. We're gonna do your supinator, so we're just gonna hold like this. And it's gonna be about 1 to 2 inches above the radius. And you'll see the fingers just kind of. Okay, good. 1 to 2 inches, 2+ on that one too. Sorry. Good, 2+. Okay, now we're going to do the knees. Good.
That was weird.
Okay, good. All graded 2+. Let's see, we're gonna do the Achilles tendon. It's right here. See the foot rise just a little bit. Let's do this side. Okay. Right here on the Achilles tendon. See the foot flap. Okay. Now we're going to do the Babinski sign. Normally, whenever I would, let's see. I'm going to do this right here. And the toe should curl. Do you usually fan them out whenever something's ticklish on your foot?
Yes, like that.
So that's going to be it. A positive Babinski sign. Okay. Now, we're going to move on to the last thing, but it's a little long, but we're almost done. We're going to test your motor function and your flexion and extension and all. So I'm just going to have you stand up. Okay. Let's start with the neck, which you've already done the range of motion on the neck. And you didn't feel any tenderness. The skin looks good all around your neck and everything looked good there. Okay, so let's do flexion, extension, lateral bending. Neck, move like this. Move like this. Okay. Rotation. Other side. Alright, looks good. So no pain, right?
No.
Okay. So now we're going to do your shoulders, okay? We'll do both at the same time. So let's lift both up over our heads. Okay. And go as far back as you can. Okay, good. Now come the other way, go as far. There you go. Okay, now that was flexion and extension. Now we're going to abduct, which is going to raise your arms like this. As far as you can. Don't move your shoulders, just keep your hands like this. Okay, good. And abduction. So as far as you can like that. There you go. Good job. Now we're going to do internal rotation. So put your hands behind the small of your back. And external rotation behind your neck. Good job. Everything looks good there. Any pain or tenderness noted on that? Okay, all the skin looks good around the shoulders, no masses or lesions, and warm skin is warm to touch. Okay, let's go ahead and do your elbows. So extension, flexion. Okay, good. Okay, let's do your wrist. Okay, flexion, extension. We're gonna do radial deviation. No, just like keep your wrist straight and just put your hand in as much. There you go. And that's ulnar. The other side is ulnar. So let's do both hands. Okay, good job. Okay, now let's do the fingers. So flexion, extension. Okay, and that would be hyperextension. Good. So flexion, straight out, extension, and then hyperextension. Okay, good job. Touch each finger to your thumb like we did earlier. Both sides. Everything looks good. Okay, no masses or lesions on the hands. Any pain at all when you were doing that? Okay, skin looks good. Distribution of the skin is good. Alright, so now let's do the spine. So we're going to bend all the way down and try to touch your toes. Okay, so bend. Okay, good. Now curve up like this as much as you can. Good job. Okay. So we're going to do rotation. Yeah, okay, good. Other side. Good. Now lateral bending. this? Both sides? Good job. Any pain?
No.
Anything like that? Okay, that looks all good. Okay, we're just gonna kind of feel your spine. Spinous processes are even throughout. Okay, bend over. Okay, no signs of scoliosis noted. Okay. Okay, looks good. Okay. Scapula looks even. Everything looks even. The gluteal folds, let's see. Gluteal folds look even. There's no masses or tenderness, right?
Right.
Okay, everything feels even. The spinous processes, everything with scapula, everything looks good on her back. Okay. Okay. Now, let's do your hips, okay? So I'm going to have you raise your leg up as far as you can without your leg bent. And you can hold on to something. Okay, good. Now, put your leg behind you now, like you would. Good. Okay, other one. And you can turn the other way if you have to hold on to that. Good. Now behind you. Good. Now do it with your knee flexed. So, up. Now, good. Same thing on the other side, please. Good. Good. Any pain noted?
No.
Okay, good. Okay. Let's see here. Okay, we're going to do internal rotation. So just like that. That's going to be, so abduction. So just put it across your body. Okay, abduction. Adduction. You have to hold on till you can. Okay, good. Other side. Good. Good. Okay, so internal rotation, as much as you can. External rotation. This is of your hip. Okay. Good job. Okay. So flex your knee like we did. Okay. Go ahead. Just go ahead and flex your knee. This will be flexion, as much as you can. Good. Okay. Extension, which is straight out, and then hyperextension. It's kind of really okay. Other side.
You want me to
Same
fix
thing.
it
Yeah.
now?
Flexion, as much as you can. Okay, extension and then hyperextension. There you go. Great, that would be hyperextension. Okay, good job. Okay. All right. Any pain with that? Okay. Skin looks good on the knee. No lesions or masses. Everything feels good there. Skin's warm. Okay. Ankles. Okay, you can sit down for this. Okay. Dorsiflexion, which is going to be up. Okay. Plantar flexion, which is down. Okay. Same thing with the other side. So you're moving this part right here, that's dorsiflexion, then you're moving your foot down, that's plantar flexion. Okay, put your foot down. Okay, now we're going to do eversion and inversion, so put your foot in like this. That's inversion, so eversion, we're going to go out. There we go, same thing with the other side. Eversion, eversion. Okay, looks good. Any pain or swelling? Nothing there, no tenderness, nothing? Okay. No masses, lesions, bruisings, or anything. All the skin looks good after doing all that. Let's see here. Now we're going to do the Fallon's test, okay? Have you do this right here? Put them together. Okay? It's an 90-degree angle right here. Can you... There, just like that, okay? So if you could see that, okay, I want you to press them against each other for 20 seconds and tell me if you feel any pain at all, okay? Are you pressing?
Yes.
Okay. Okay, it's been 10 seconds. Any pain?
No.
Okay. 15. 20. Okay, any pain at all?
No.
Okay, good. Now we're going to do the Tennille's test. You wrapping it up. Okay. Put your hand right here. Flip it over for me. Okay, just kind of relax like that. Okay. I'm going to tap right here. You feel any numbness at all in your digits?
No.
None. Okay. Here?
No.
No numbness? Okay, usually this will test for any numbness right here in this first, second, or third third and half digit, okay? Same thing on the other hand, please. Okay. Relax your hand, there you go. Any numbness?
No. No.
Okay. One more thing I forgot to do on the range of motion. Arm straight out, hold like supinator, pronation. Okay, good. And do we do your elbows? Flexion, yeah, flexion, extension. Okay, good job. Okay. All right, I'm gonna look at my note card for 1 second and make sure I got everything. So I only get a minute to do this, so let me open it up real quick. If I can find it. Okay, so I get 1 minute to look at this. Okay. Okay, I also didn't notice any breath odor on the patient at all. Okay. Patient seems clean and well groomed. She's female. She was alert already ×3. Her gait was smooth and steady. Her arms moved while she walked in a nice position. And I think that's it. Okay.
Ready to turn it off?
Mhm.